this very broad nose, well-defined, beautiful dorsal aesthetic lines. You can see droopy before surgery, and you can see the hump there. The nose was convex.
So we have one more patient for rhinoplasty. You can see from the front profile that he has got a very broad tip and dorsum. It's very broad here, and also there's some uneven bony thing there, so it's a small hump with that we are planning to reduce as well in the same surgery. So you can see from the side profile that he's having a droopy tip which is unsupported as well. So we are planning to lift the nose, improve the projection. You can already see that he's getting a very good change in the nasolabial angle as well. So this is the nasolabial angle that we are planning to do, which is almost 90 to 100 degrees. So this is acute now before surgery. This is almost less than 60 degrees, which is suggesting that he's got a droopy tip, and also is having issues with the dorsal hump. It's quite sharp here that we are planning to file in the same surgery, and also we are planning to do some augmentation here till the supratip region, lift it a little bit, and from the front profile we can see he's got a bifid tip as well. So we're going to lift the nose, also do some cephalic trimming to reduce the lower lateral cartilages there, and reduce the width by lifting the nose. So width of the nose also will be reduced, and we are planning to do some augmentation to give him a stride dorsum in the same surgery. And I'll show you the basal view. So you cannot see the nostril show because the tip is very droopy and looking downwards. So we're going to lift it, which gives him a better exposure of the nostrils, give him a very good triangle projection of the nose, and also we're planning to reduce the length of the nose, which is increased because of the droopy tip, and reduce the width as well. So also he's got issues with the deviation of the nasal septum or the DNS. So if you can closely observe there, the septum is deviated to the left side. We are planning to do the septoplasty as well in the same surgery. So this is going to be a septo-rhinoplasty. So we're going to use some rib cartilage if we don't get enough nasal septal cartilage. So this is going to be a rib rhinoplasty along with septoplasty in one go.
So only that is remaining is the superior and as well as the inferior part.
So this is immediately before revision septo-rhinoplasty of a patient having a flat and very broad nose. So this is immediate results on table. You can see how he has got a very good augmentation and good projection. So we have used spreader grafts, septal extension graft, tip grafts, and also used some disc cartilages and osteotomies to reduce the width. So this is the side profile. You can see how tip was droopy before starting, and this is immediately after results. ಮೂಗು ಪ್ರೆಸ್ ಮಾಡ್ತೀನಿ ಗಂಟ್ಲಲ್ಲಿ ನೋವಿದೆಯಾ? Alright, so today is day 1 following his rhinoplasty, septo-rhinoplasty surgery. And he's not having much swelling in the nose or even the throat, which is a good sign. He's having a discomfort in the chest, so which is going to improve in another 2 to 3 days. So today is, as I told you, just 3 days after rhinoplasty surgery. He's doing well, and all these pack and as well as the splint are tight, they are intact. So this is helping for the patient for the swelling to come down. You can already see that swelling has come down a lot compared to the day 1 and 2. He's doing well. Uta tindi ella ಮಾಡ್ತಾ ಇದೀರಾ? Okay, he's on his regular diet, and let's see how the recovery goes in the following days. So this is how the recovery after 2-3 days goes on, the swelling starts coming down, the pain starts coming down. So let's see how the recovery goes in the following days. Thank you.
Right, so today is day 5 following rhinoplasty with rib graft for this patient. So you can see that swelling is completely gone for this patient. So we're gonna remove the back of the dressing that was kept on his rib side, the chest. We'll check for any collection that is there, and we'll do some dressing there. This part, loose bit. So you can see that there is no stitch mark there. There will be stitches at the end, and it goes running below the skin. So this is a technique where patient will have a better scar and no stitch marks like the usual technique that was practiced in the earlier years. So we are slowly taking out the pack which was kept inside his nose for 5 days. Especially in this case, we kept it for 5 days. That's because it's a revision case. He had already undergone septoplasty. His septum was very weak. We had to do the reconstruction of the septum as well. Alright, so today is day 10, splint removal day for this young patient. So I'll show you the transformation. We have just removed the splint. So that's why you can see some swelling there. And this is before. A huge transformation from this very broad nose to well-defined, beautiful dorsal aesthetic lines. You can see a very good bridge. So this is before surgery. You can see that he was having no definition in the nose. It was flat, very broad nasal bones, and also the width of the nose was very broad. The tip was drooping downwards. I will show you the other views. So this was the main concern why he approached us. So you can see the transformation there. So his concern was the tip was looking downward, and also there was no definition of radix or dorsum, and the tip was very unsupported before surgery. So remember, this is the revision rhinoplasty. So he had very weak septum which was removed in his primary surgery. So now he has got a beautiful and a very good support for his tip. And look at that nasolabial angle that he has got. He's got a very good 100 degrees or 90 degrees good projection of the tip, which was droopy before surgery. And you can see the hump there. The nose was convex. He has got a very good straight nose now after surgery. This is just 10 days. And you can also see how we have improved the lower lateral cartilages, the alar relation to the tip. Everything has been improved. He's got a good projection. You can see how we have improved the tip projection, and also the length of the nose is balanced for his face. You can see that clearly in. So you can see the tip was looking downwards before surgery. The tip is lifted up, good projection, good tip support. So this is before and after. You can see how the dorsum was convex there. Now he has got the side profile as well, good, nice and straight, good thickness of the bone. So this is one more view, 45 degrees. So this is before and after. And also you have to appreciate the thickness of the tip where it was very bulky, bulbous before surgery. Now we have done the cephalic trimming, we have done the tip-plasty to give him this beautiful tip projection. See how thick was before, and now good tip projection as well. So the tip thickness is also well balanced for his face. He has got a slim face, long face, dolichocephalic face. So for this patient, now the nose is suiting. So this is the front profile. So you can see how he had a bifid tip. You can see the two tips there, bifid tip. This is what we call. Now he has got a single tip, beautiful projection, a very broad tip there, and now we have narrowed down the thickness of the tip, and also the width of the nose is now balanced for his face, which was flaring a little bit before surgery. So this is also balanced, good dorsum. So we have done dorsal osteotomies, nasal osteotomies to reduce the width of the nose, You can see how broad was the nasal bones before surgery. So that has been brought to the center, and this thickness has been reduced and balanced. So here still you can see some swelling there. So this swelling will come down, will take a lot of time. It usually takes 4 to 8 weeks for the initial swelling to come down. And also you can see the discoloration of the skin, that is the ecchymosis, which is again because of the osteotomies that we have done. This will take another week time for this discoloration to come down. Otherwise, he's absolutely doing well. And he had gone home few days back, and we have come today for the splint removal. So ನೋಡ್ಕೊಳ್ಳಿ, ಖುಷಿ ಆಯ್ತಾ? ಓಕೆನಾ? ಸೈಡ್ ಪ್ರೊಫೈಲ್ ತೋರಿಸ್ತೀನಿ. ಹಾಗಾದ್ರೆ ಏನು ಎಕ್ಸಾಮಾ ಎದುರ್ಕೊಳಕ್ಕೆ? ಸೊ ಮುಂಚೆ ನಿಮಗೆ ಇನ್ನೊಂದು ಫ್ರಂಟ್ ಪ್ರೊಫೈಲಲ್ಲಿ ನೀವು ನೋಡಿದ್ರೆ ಹತ್ತಿರದಿಂದ ಇದ್ರಲ್ಲಿ ನೋಡ್ತಾ ಇರಿ, 2 ಟಿಪ್ ಕಾಣ್ತಾ ಇದೆ, ಹೌದಾ? ಸೊ ಇಲ್ಲಿ ನಿಮಗೆ ಟಿಪ್ಪು ಒಂದೇ ಆಗಿದೆ, ಸಿಂಗಲ್ ಆಗಿದೆ. ಆಮೇಲೆ ಇದು ಸೈಡ್ ಪ್ರೊಫೈಲಲ್ಲಿ ತೋರಿಸ್ತಿದ್ದಾಳಿ. ಓಕೆ, ನಿಮ್ಮದು ಟಿಪ್ಪಿಂಗ್ ಸೈಡ್ ತಿರುಗಿದ್ರೆ ಕೆಳಗೆ ಹೋಗ್ತಾ ಇತ್ತು ಮುಂಚೆ, ಕರೆಕ್ಟಾ? ಸೊ ಯು ಕ್ಯಾನ್ ಸಿ ದ ಟಿಪ್ ವಾಸ್ ಡ್ರೂಪಿಂಗ್ ಡೌನ್ವರ್ಡ್ಸ್. ನಾವು ವಿ ಹವ್ ಲಿಫ್ಟೆಡ್ ದ ಟಿಪ್ ಲಿಫ್ಟ್ ಆಗಿದೆ, ಹೌದಿಲ್ಲ? ಆ್ಯಂಡ್ ಇದು ಬಿಫೋರ್ ಸರ್ಜರಿ ತುಂಬ ಬ್ರಾಡ್ ಇತ್ತು ಈ ಜಾಗ, ಏನು ಲೈನ್ಸ್ ಇರಲಿಲ್ಲ. ನೌ ವಿ ಹವ್ ಗಾಟ್ ಅ ವೆರಿ ಗುಡ್ ಡಾರ್ಸಲ್ ಎಸ್ಥೆಟಿಕ್ ಲೈನ್ಸ್ ಆನ್ ಬೋತ್ ದ ಸೈಡ್ಸ್. ಕಾಣ್ತಾ ಇದೆಯಲ್ಲ ನೋಡಿ ಹೆಂಗಿತ್ತು? ಫುಲ್ ಫ್ಲ್ಯಾಟ್
ಇದೆ,
ಕರೆಕ್ಟ್ ಅಲ್ವಾ? ಆಮೇಲೆ ಇಲ್ಲೂ ತುಂಬ ಅಗಲ ಇತ್ತು ನಿಮಗೆ. ಸೊ ಇಲ್ಲೂ ನಿಮಗೆ ಒಳ್ಳೆ ಶೇಪ್ ಬಂದಿದೆ. ಇನ್ನೊಂದು ಇದು ಇಂಪಾರ್ಟೆಂಟ್ ವ್ಯೂ. ಸೊ ಯು ಕ್ಯಾನ್ ಸಿ ಬಿಫೋರ್ ಸರ್ಜರಿ, ಸೊ ದಿಸ್ ಪಾರ್ಟ್ ಆಫ್ ಯುವರ್ ನೋಸ್ ವಾಸ್ ಕಾನ್ವೆಕ್ಸ್, ಇಟ್ ವಾಸ್ ನಾಟ್ ಸ್ಟ್ರೈಟ್. ನೌ ಯು ಸಿ ಗಾಟ್ ಅ ಗುಡ್ ಸ್ಟ್ರೈಟ್ dorsum. ಕಾಣ್ತಾ ಇದೆಯಾ?
ಕಾಣ್ತಿದೆ ಸರ್.
ಆ್ಯಂಡ್ ದಿಸ್ ಪಾರ್ಟ್ ಇಸ್ ಆಲ್ಸೋ ಲಿಫ್ಟೆಡ್ ಅಪ್, ದಿಸ್ ವಿಚ್ ವಾಸ್ ಲುಕಿಂಗ್ ಡೌನ್ವರ್ಡ್ಸ್ ಬಿಫೋರ್ ಸರ್ಜರಿ. ಕರೆಕ್ಟ್? ಸ್ವಲ್ಪ ಈ ಕಡೆ ತಿರುಗಿ. ಓಕೆ, ಸೊ ನೌ ದಿಸ್ ಇಸ್ ಲಿಫ್ಟೆಡ್ ಅಪ್, ಯು ಗಾಟ್ ಅ ಗುಡ್ ಪ್ರೊಜೆಕ್ಷನ್ ಆಫ್ ದ ನೋಸ್. ಆ್ಯಂಡ್ again, dorsal aesthetic lines was not there. Now we have got beautiful dorsal aesthetic lines on both the sides. Okay, so this is before and after, immediate 10 days after revision septo-rhinoplasty surgery. ಹೇಗಿದೆ?
ಚೆನ್ನಾಗಿದೆ ಸರ್.
ಚೆನ್ನಾಗಿದೆಯಾ?
ಅನ್ಕೊಂಡಿರಲಿಲ್ಲ ಇಷ್ಟು ಚೆನ್ನಾಗಿ ಬರುತ್ತೆ.
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು.
ನಾನು ದಾವಣಗೆರೆಯಿಂದ ಬಂದಿದ್ದೀನಿ. ನಾನು ಸೆಪ್ಟೋ-ರೈನೋಪ್ಲಾಸ್ಟಿ ಮಾಡಿಸ್ಬೇಕಂತ ತುಂಬ ಕಡೆ ಸರ್ಚ್ ಮಾಡಿದೆ. ಬೆಂಗಳೂರಲ್ಲೆಲ್ಲ ಸರ್ಚ್ ಮಾಡಿದೆ, ಮೈಸೂರಲ್ಲೆಲ್ಲ ಸರ್ಚ್ ಮಾಡಿದೆ. ಸೊ ಯಾವ ಹಾಸ್ಪಿಟಲು ಸರ್ಟಿಫಿಕೇಷನ್ಸ್ ಅನಿಸ್ಲಿಲ್ಲ. ನಾನು ಹಿಂಗೆ ಸರ್ಚ್ ಮಾಡಬೇಕಾದ್ರೆ ಶಿವಮೊಗ್ಗದಲ್ಲಿ ಪ್ರಾಯ ಆಸ್ಥೆಟಿಕ್ ಅಂತ ಹಾಸ್ಪಿಟಲ್ ಇದೆ ಅಂತ ಗೊತ್ತಾಯಿತು. ಸೊ ನಾನು ಯಾಕೆ ವಿಸಿಟ್ ಮಾಡಬಾರ್ದು ಅಂತೇಳಿ ಒಂದು ಸತಿ ವಿಸಿಟ್ ಮಾಡಿದೆ. ಡಾಕ್ಟರ್ಸ್ ಆಗಲಿ ನರ್ಸಸ್ ಆಗಲಿ ತುಂಬ ಚೆನ್ನಾಗಿ ನೋಡ್ಕೋತಾರೆ. ನೀವೇ ನೋಡ್ಬೋದು ನನ್ನ ನೋಸ್ ಹೇಗಿದೆ ಅಂತ. ಮುಂಚೆ ಫುಲ್ ವೈಡ್ ಇತ್ತು. ದೇರ್ ಈಸ್ ಅ ಲಾಟ್ ಆಫ್ ಡಿಫ್ರೆಂಟ್ ನೋಸ್ ಆ್ಯಂಡ್ ನನಗೂ ತುಂಬ ಇಷ್ಟ ಆಯಿತು. ಸೊ ನೀವೇನಾದರೂ ನೋಸ್ ಸರ್ಜರಿ, ರೈನೋಪ್ಲಾಸ್ಟಿ, ಸೆಪ್ಟೋ-ರೈನೋಪ್ಲಾಸ್ಟಿ ಮಾಡಿಸ್ಕೋಬೇಕಂತ ಇದ್ದರೆ ಸೊ ಒಂದು ಸತಿ ವಿಸಿಟ್ ಮಾಡಿ.